Good evening, everybody. My name is Robert Nolan, and I'm Chair of the Community Relations Committee of Health and Hospitals. Due to our problems of technology, we will not be able to have the visual part of our meeting tonight available to you, but the audio is available, so we'll be able to hear the reports that are made by the various heads of CABs at our local hospitals and other reports through audio. And with that understood, I apologize on behalf of the board that we could not get that working, and also that we're running about 15 minutes late. So with that, I want to move on so that we can get our business done. So I hereby call to order the meeting of the Community Relations Committee of the Board of Directors of New York City Health and Hospitals for Tuesday, January 10th, 2023. Please note for the record that Deborah Brown is representing Dr. Mitchell Katz in a voting capacity. And also that Dr. Patricia Marthone, a board member also, is attending virtually in a listening capacity only. I now call a motion to adopt the minutes of the November 15th, 2022 meeting, and I will ask and recognize each of the board members for their vote in favor or not in favor. Chairman Jose Pagan.
Yes.
Yes. Deborah Brown.
Yes.
Yes. Sally Hernandez Pinheiro.
Yes.
Yes. And as chair, I vote yes also. So there's 4 voting yes, and the motion carries. The minutes are adopted. Thank you very much. I want to start by congratulating New York City Health and Hospitals, the South Brooklyn Health now, not Coney Island anymore, but South Brooklyn Health, for welcoming the city's public health system's first baby of 2023 at the stroke of midnight, named Kingsley, and I can't help but saying the fact that one of our top drivers within the system here, Kingsley, is also now has another Kingsley, but it's not him. This is not his family. But I don't know how many Kingsleys you know, but now I feel like I know 2. But I want to say that Kingsley Mai was born to parents Dexter and Holly. This is the Brooklyn couple's first boy. The city's public health system delivers approximately 15,000 babies annually. The health system's 11 hospitals provide expert prenatal care, labor, and delivery services, family planning, comprehensive gynecology, women's health, and primary care outpatient medical support for women at every stage of life. And God bless our hospitals, and God bless all of those women who come in to give birth at our hospitals. Tonight, we plan on having 4 community advisory boards reporting to us: Health and Hospitals Carter, East New York, Kings County, and Queens. Now, I'm going to turn the meeting over to Ms. Brown in Dr. Katz's absence, who has a brief report. Ms. Brown?
Thank you. Hello, everyone. It's really nice to see you in person. I want to augment something that the chair said, which this is the 4th year in a row that South Brooklyn Health, previously Coney Island, had the first baby of the year. There is something in the water down there. I don't know what it is, but it's pretty remarkable. Okay, real quick, a couple of really exciting things to announce. We announced the successful first year of our Peer Academy, which is a training program for people who have lived experience with mental health or substance use conditions, and they become peer counselors to serve our patients and serve the community. 12 of the 18 graduates in the first class have been hired as peer counselors in our system, and we currently have 83 peers on staff across the system, which means this is the largest hospital-based peer workforce in the city. To me, this really speaks at where we want to be on this committee, which is sort of at the juxtaposition of great care for people as well as meeting the needs of our community in lots of ways. It's something that makes me very proud. Real quick, that North Central Bronx received top teaching hospital designation from the Leapfrog Group. That makes them one of only 58 hospitals nationwide to earn that award this year. And last month they got an A grade from the Leapfrog Group, and that makes them the only hospital in Bronx to receive that designation. This is a national honor. There's going to be a recognition at a national sort of gala in Washington, D.C., and it's something we're very proud of them. There's a lot to brag about there. Also, something really important, New York City Health and Hospitals honored 32 nurse professionals from across the system as part of our recent Nursing Excellence Awards. And these were nurse professionals that were selected from a record 560 nominations. And it includes nurses from across our system, all our facilities, all our service lines. 24 nurses were recognized for excellence in clinical nursing. 4 nurses were recognized system-wide for their efforts in leadership. Another 4 nurses received the Daisy Award for nurses, and that's for advancing health equity, which was created by the Daisy Foundation to honor nurses who kind of go above and beyond. There were South Brooklyn Health, again, they're getting a lot of kudos tonight. They won the 3rd Annual Structural Empowerment Award, and that's presented to nursing leadership for their commitment to achieving higher performance level. And then something that I know is really important to us as board members and you know, to many of you, which is the 3rd Annual Josephine Bolus Nursing Championship Award. That's our highest nursing honor bestowed in the name of the late, great Josephine Bolus, a huge supporter of nurses in our system and a long-term board member. It was presented to Barbara Lowe, another one of our board members, a retired nurse executive and public health educator. So it was a really nice, touching ceremony. And that's a quick update. I would recommend Dr. Katz's full report is in the board book, but also one of the things that we did for the CAB meeting that will follow this is print out. We have a list of 2022 sort of by the numbers, lots of achievements around the system. So we'll talk about that later on, but I would recommend folks read that too. Thank you.
Thank you very much, Ms. Brown. I'm going to now move forward to the presentation of our 4 facilities and remind all of our speakers that you have 5 minutes to present your report. If during that time you don't get a chance to get everything in, you can please see me after our meeting, but I'm looking at my watch. This is 5:25. So with 4 reports this evening, that puts us in the range to be able to finish our meeting about 5:45 or 10 to 6 and give Ms. Dixon a chance to bring together everybody for a 6 o'clock meeting. So with that, I'm going to call from the Henry J. Carter Specialty Hospital and Nursing Facility, Trayvon Butler.
Good evening, everybody. I'm Trayvon Butler, filling in for Chairwoman LaShawn Henry, who couldn't be here tonight. He had to attend to a personal matter, so I'm filling in as a fellow CAB member. I also want to acknowledge our CEO, Floyd Long, who's here in attendance, and our patients director, here in support as well. To give the update for Henry J. Carter, our COVID response, Carter, we're playing a significant role in the community. We're still at a health and hospitals level activities, and we have successfully met the challenges served and played a significant role with our response within the health and hospitals community. Just to give a little update, some stuff on COVID. COVID and activities continue to increase in the community while those things are happening in the community. Carter cases are still low, and staff and patients are educated and encouraged to get the new benevolent booster. On the updated front for our equipment and infrastructure side, our long-term acute care hospital and nursing facilities for the full 2022 full calendar year, we introduced bedside dialysis and den-style dialysis in the nursing facility. Just to give some stats on those 2 items, inpatients dialysis program does allow Carter to admit vent-dependent dialysis patients and residents. Our max capacity for the long-term acute care facility right now is at 19 for bedside dialysis, and for the nursing facility is 8 for the den-style dialysis. The dialysis program is expanded our services to patients that previously were not candidates for admission, and estimated annual revenue is expected to increase. And our patient and safety and satisfaction update category. Patient and safety satisfaction is a continued priority for the leadership, the CAB, and the staff at Henry J. Carter. Throughout the most pressing periods, we've seen some of the highest press scores for both patient and experienced staff engagement. To give you some results on that, for 2022, patients, residents, our results for the long-term acute and care facility rated overall in the 92 percentile, in the nursing facility and overall 98th percentile. In the nursing home, Carter continues to earn a CMS 5-star rating and was named in Newsweekly magazine's Best Hospitals list. We were on that list, ranking number 4, top 5 out of 600 hospitals in the state of New York. In the long-term acute side, our facility has also earned a Tenniel Joint Commission accreditation and achieved over one of the best ventilation wearing rates in the country, wearing over 70% of our patients entering wearing trials. Some of the programs that's coming up for the year of 2023. We do have a New York State Department of Health approve our nursing aid certification program. To date, Carter, we had 20 CNA graduates. This program is open to the community. We encourage those, and we continue to encourage those within the East Harlem community and throughout the city of New York to join. In 2023, we do plan to open outpatient radiology and rehab service in the hospital and expand our telemetry and ventilator services in our nursing facility. The diagnostic radiology testing will include CT scan, ultrasound, and bone density. That's something that a lot of our folks in the community have been looking forward to, and we're happy to bring that and provide that service in 2023 as we continue to grow and expand throughout the pandemic. That is the full report. I did want to pass along some acknowledgments. Before I end my report, I want to acknowledge Congressman Adriana Espaillat, who's been very supportive, Manhattan Borough President Mark Levine, New York State Senator Cordell Clare, New York State Assemblywoman Inez Dinkins, New York State Assemblyman Eddie Gibbs, Councilwoman Diana Ayala, our Henry J. Carter wheelchair attendees Hank Carter, the Carter Auxiliary, Community Board 11, Uptown Grand Central, Carrie King, the NYPD, the FDNY, and NYSHA tenant associations within the area. And that is the Henry J. Carter report. Thank you.
Thank you very much, Mr. Butler. I'd like to ask you about on your listing where you listed the 2 frequent complaints. One was delay of care. Is there any one particular part of the work that's done there at Henry Carter where there's a greater need for a facilitation of appointments sooner than later? Does one really stand out?
When we talk about delay of care.
Could you raise your voice?
Oh, I apologize.
No, it's a problem when we, yeah.
I'm trying to breathe.
Yes, yes.
So, in terms of delay of care, or specifically regarding our communication with patients, I'm not sure what you're.
You want Floyd?
Can you come to the table, please, Mr. Law?
Good evening to everyone. Just to introduce myself, I'm Floyd Long, and I serve as CEO at Carter Specialty Hospital and Nursing Facility. The results in terms of our analysis of the press gaining survey, we found opportunities as a result of our review to be able to look at the delays in care, as well as some of the issues around communication. Those were the 2 standout areas where there were opportunities to improve. So when you ask the question, what types of delays centered around our call bell response, and with that, part of our plan to address the call bell response deals with frequent rounding by our unit nurse leadership, our head nurse, and the charge nurses on the evening tours to better anticipate the needs of the residents. And keep in mind that the survey was at a time where the pandemic was at not at the peak. So we did not have as many family visitors in the building. And oftentimes in the evening, they definitely support the assistance of our resident population. So we did not have that familial help. And then also with the communication, that dealt with letting residents and their families know about team meetings as well as potential appointments. There were some opportunities for us to better communicate and send out information well in advance. So family members, if they elected to attend appointments that were off-site, they could make arrangements. So to address the communication piece, our post-acute care service line uses point-click care as the medical record, electronic health record. And we elected to purchase an option that allows us to communicate with the families electronically via the PCC, point-click care medical record. So in addition to the traditional
Excuse me, you have another 30 seconds.
sorry,
No, go ahead.
traditional telephone calls, we're now able to send emails when the family members have provided their email addresses, so we can better communicate with them.
Okay, thank you very much. Thank you for your amendment there, and thank you, Mr. Butler, for your report. And congratulations on the good work being done at Henry J. Carter. We're going to move on, and we're going to ask Vera Gibbs from East New York to report. Ms. Gibbs?
Thank you. Okay, Mr.
Hi, how
Nolan
are
and
you?
other board members of CRC, good evening. I am Vera Gibbs, and I'm here to give the report of Gotham Health East New York. I am the current staff chairperson. During the COVID-19 pandemic, the Gotham East New York site offered COVID-19 testing and vaccinations to our patients and the surrounding Brooklyn community. Since December 2021, the facility has successfully administered nearly 19,000 doses of the Moderna vaccine to children and adults. We continue to encourage all of our patients to obtain the primary COVID-19 vaccination series, also encouraging both staff and patients to receive the latest bivalent booster. We adhere to the New York City Health and Hospitals infection control protocols from April 2022 regarding personal protective equipment. This includes N95 and eye protection for all clinical encounters. A significant and persistent number of staff continue to be unavailable for work due to illness, worsening over the past few weeks. This current influenza season. In August 2022, we hosted a meet and greet with Brooklyn Borough President Antonio Reynoso, his first visit since taking office in 2022. Our leadership and CAP team offered a clinic tour of various patient settings and a detailed overview of programs and services, and discussing support to expand women's health services. The fiscal year 23 adopted budget was passed in June 2022. East New York was awarded a total of $1.6 million in capital funding from New York City Council members Charles Barron and Sandy Nurse for improvements to HVAC, electrical, and lighting infrastructure to optimize efficiency and create a more sustainable health center. New York State Senator Roxanne Prasad awarded us 2 grants, $100,000 for new furniture in patient waiting areas, $110,000 for upgrade to the main entryway and exterior lighting. Complaints still continue for long wait times, no COVID testing access for non-patients, walk-ins, and the big question, when will we be getting the GYN clinic back? Patient safety and satisfaction. We continue to monitor our Press Ganey scores and respond to negative feedback in a timely fashion. We aim to let each patient have the positive experience. We also do our eye care rounding to address patients' issues in real time. The issues that are impacting our communities served by the facility include COVID-19 vaccines and boosters, RSV and flu, nutrition and weight management, diabetes management, and chronic disease management. With the support of our Community Advisory Board and the Community Affairs team, we continue to build on Gotham Health, East New York's long-standing reputation as a trusted care provider to Brooklyn's most vulnerable and underserved communities. We accomplish this through active participation in community events, promoting health education and awareness in the neighborhoods that need it the most. There are pictures here that show a few of the community highlights: National HIV Testing Day event, Breast Cancer Awareness, Halloween reading and book giveaway, World AIDS Day event, holiday toy giveaway for pediatrics. I'd like to acknowledge Charmin Valentine, Lillian Hines, Delisha Marshall, Melvin DeCosta, who are here with me from East New York, Gotham. And we'd also like to acknowledge Brooklyn Borough President Antonio Reynoso, New York State Senator Roxanne Prasad, New York City Council Member Charles Barra, New York City Council Member Sandy Nurse, and New York City Council Member Darlene Neely.
Thank you very much, and thank you for that extensive report. I see under the area of frequent complaints, the fact that you have staff challenges in most areas, which is really keeping you from being able to complete what you want to complete there. So we understand that, because staff challenges are faced by hospitals, not just our city hospitals, but in the private sector also. And I see that's the recruitment challenges is a problem when it comes to getting your GYN clinic back. Is there any up-to-date information on that as to when you think you might be able to get the GYN clinic back, or is it still subject to recruitment of trained personnel? Then I'll ask the board members if they have any questions after this of East New York.
Yes, we still
Let's
have,
get in front of that microphone there.
good afternoon, everyone. Yes, we do have a challenge recruiting.
Please speak into it so we
for
can hear you
G-
better.
We have a challenge recruiting for GYN. So anybody here who knows anyone who's an MD and NP wants to work in GYN, please send
You
them.
sure is a welcome.
It is that serious. We're working with the PAGNI team, not anyone with PAGNI, who is also working for us diligently for us to fill those positions. We still have-
Thank you very much. I really appreciate it. Are there any questions from the board members?
I have one.
Sally, go right ahead.
For Floyd, of the dialysis units that are available, about what percentage are being used?
I don't know that we have dialysis right now.
No,
Oh, for Floyd, I'm sorry, I went back to Carter for a quick minute. I don't think we have.
I know we don't.
You're like, hey, that's not me. What percentage of your dialysis units are used, on a consistent basis?
Well, we, in the hospital, there's a max of 19, which is
Right.
the top census. And we average around 14 patients, on a daily census, daily average. In the nursing home, our, capacity is 8. And we generally average anywhere from 7 to 8 nursing home residents receiving dialysis.
That's great, thank you so much.
Are there any other questions from our board members? I want to thank East New York for their report and congratulate them on the accomplishments of the last 6 months, and for your presentation, which is not just extensive, but beautiful color pictures of the work that was done and many of the good things that are going on at Gotham Health in East New York. So we're going to move on to Kings County. Jewel James Nesbitt will report for Kings County.
Hi, good evening.
Good evening.
I'm the second vice chair for the CAB at Kings County, and I will be making a presentation of our annual report. So in reference to our COVID-19 response, since early December 2021, NYC has been in the throes of a fourth wave of the COVID-19 pandemic. And though this remains a challenge for all of us, we're incredibly grateful for the support of our health system, our central office colleagues, and our sister facilities as we work to mitigate the impact of the Omicron virus. There's a few things that our hospital has done in response to this crisis. We modified the existing units to easily transition the surge so that we can have the capacity to meet the increased demands. We utilized the tool of having a ED screening process, which was launched in December 2021. When patients were discharged from the ED, they were given a take-home COVID kit, and this has helped to significantly reduce the number of patients waiting in the ED. Another method that was used is that telehealth visits instead of having in-person visits when we were able to do so. And during this time, as you all may be aware, there were some issues with physical and psychological well-being of staff. And one of the things that was done is that we reinitiated the command center nourishment grab-and-go snacks so that on a regular basis, staff would be able to just grab something. In terms of equipment and infrastructure, in July 2022, our borough president, Reynoso, allocated $15.6 million in capital funding to improve Kings County's mother, baby, and NICU maternal health units. Part of the plan in using that money will be to create a state-of-the-art family-centered birthing center. In September 2022, the hospital's leadership implemented a monthly meeting, which included participation by all stakeholders to discuss the project goals, the phasing, and the steps necessary to bring the project to fruition. On December 13, 2022, the hospital's leadership met with the borough president so that he could get a look at the space and determine how the funds can be used to allocate and implement the projects that as previously stated. Some of the issues impacting the community served by the facility. In 2022, Health Plus Health conducted a system-wide community health needs assessment, which included an assessment of the issues that specifically pertain to the community served by our community. Stakeholder interviews, community focus groups, staff input, and community data were provided to gather an array of information. The key areas of concern that were noted for the Central Brooklyn were consistent with those noted throughout the borough. They are poverty and housing issues, food insecurity, access to healthcare and resources, health equity, crime and safety, the impact of COVID-19 on the community. Additionally, some other concerns noted for our population were heart disease, stroke, diabetes, hypertension, cancer, end-stage renal dialysis, substance use, mental health, and amongst other health conditions. Kings County remains committed to addressing these health concerns through continued investments in our clinical programs established to meet the needs of our community. We are also involved in a number of community-based organizations through outreach initiatives to collaborate on meeting many of the socioeconomic issues raised. 2022 regulatory survey highlights. So Kings was recertified as a level 1 trauma center by the American College of Surgeons in April. This important asset allows life-saving interventions to be performed right here in our community. Kings has been recertified as an advanced primary stroke center, a critically important service that ensures our community members a better chance of recovery after a stroke. Kings has also been granted provisional membership in the National Abortion Federation. This strengthens our dedication to providing women in our community with access to reproductive options. And lastly, Kings successfully passed the New York City Department of Health and Mental Hygiene annual review of the mobile crisis unit for our comprehensive psychiatric emergency program. In terms of the hospital consumer assessment of healthcare and provider systems and patient satisfaction, during Q4, the survey satisfaction scores have noticeably improved across all service lines. This data helps to tell the story of our journey to excellence in person-centered care. We consistently receive feedback in our patients' own words about their experience, such as I felt safe, my experience exceeded my expectations, and I felt like I was and am important. As a result of the collaborative efforts among our nursing, care experience, and quality departments, Kings County is the system leader in nursing communications.
Excuse me, Ms. James Nesbitt. Could you please conclude in the next minute?
Okay, yes.
Thank you so much.
In terms of patient satisfaction, our journey to excellence in in-person centered care has resulted in significant improvements in the patient experience and employee engagement, as evidenced by results in our patient satisfaction and employee culture surveys. I think I'll go on to the last slide before acknowledgements, which is frequent complaints by patients and residents and how the facility is working to resolve these issues. Frequent complaints have been wait times in the emergency department, ability to reach outpatient service providers and practices, communication regarding discharge from inpatient settings, and property loss. The following improvement activities represent these efforts. There was a care improvement contest, provider rounds in the emergency department to improve patient flow through the
10 seconds, please.
Okay, my dry utilization project, and lastly, patient property work group to identify issues with the property process of correction. And we just want to acknowledge Health and Hospitals for their unwavering dedication to meeting the needs of the healthcare needs of the Central Brooklyn community.
Thank you very much. And I apologize for moving you on a little faster than but we are now at 10 minutes of 6.
Okay.
Thank you very much. I have no questions. Do any other board members have questions of Ms. James Nesbitt at all? No questions. Seeing none, thank you so much. We deeply appreciate it and send our best to all the hardworking people at Kings County. Finally, Queens Hospital, Robin Hogan, the CAB chair. Ms. Hogan?
Good evening, all.
Good evening.
Before I begin, I just want to acknowledge and thank my Queens Hospital family for coming out and support. We have CEO Moore, we have Executive Director Edwards, we have Ms. Springer, liaison. I have my first vice chair who is here, and I also have Mr. Monroe of Labor Relations. So we have a nice little support here this evening. So, just to begin, the COVID-19 response. We have really been doing a lot in Queens to date. We've been tackling with the COVID and the flu, both cases, because of the increase in the on-rises we all know of. Queens has actually serviced a little under 116,000 COVID-19 vaccines to date. COVID testing is still available next to the pavilion on 164th Street and ongoing. With regard to the equipment and the infrastructure, Queens is working on a master plan initiative that will determine our plans for the hospital over the course of the next 5 to 10 years. So it will be putting up different types of structure, improving some of the equipment, and advancing ourselves as we go along into 2023 and forth. One of the projects that's also a part of the moving forward is the hospital is undertaking a project to upgrade the patient's room, as well as improving the wayfinding with the intent of including patients and community members into our projects as part of the commitment to the plant tree concept of patient-centered care. With regard to our patient and safety satisfaction, this year, Leapfrog, we have earned a score of A for the spring and the fall of 2022. The survey used 22 national performance measures from CMS. Thank you. Information from other supplemental data sources. Also, we have, when it comes to our nurses communication top box score, in the year of 2021, we were at 71.3%, and we increased by 5% because in 2022, we had a score of 75.0%. So that was a significant milestone and a movement forward for us. Patient complaints. For the fiscal year July of 2021 to June of 2022, there have been 42 grievances. During the same time period, there has been 66 complaints. And what Queens Hospital has done, they have used those complaints to utilize it as an opportunity for improvement. So each complaint is actually looked at. There is a team that's put together, supervisors, there's an investigation, a full review. So nothing just falls by the wayside. And keeping into compliance with our iCare contract. Accomplishments for 2022. A recent survey review from the Joint Commission indicates that Queens will be acquiring designation as an advanced primary stroke center, which is a great move for us. We also have a wonderful relationship with the LGBTQ community, healthcare equality for 2022. We are one of the 4 New York City health and hospitals ranking among the 50 most racially inclusive hospitals in America by the 2021 Lone Institute Hospital Index for Social Responsibility. Received nationwide ranking of a 14 out of 2,800 hospitals in April. Once again, we also received the A in the Leapfrog. Also, we received an achievement award from the American Hospital Association entitled Get the Guidelines Heart Failure Gold Plus Target, Type 2 Diabetes Honor Roll. We received that in June of 2022. We also obtained certification of recognition from the American Diabetes Association for educational services of the Diabetes Center of Excellence in meeting national standards for diabetes self-management education. We also received the Silver Award Target BP from the AMA/AHA in recognition of commitment to improve BP control in October. So Queens is moving forward. And just to say some acknowledgements, we would like to extend our gratitude to New York City Health and Hospitals, Queens Clinical and Operational Leadership for the tireless commitment to serving the healthcare needs of our neighborhoods in Southeast, as well as our strategic partners who help to amplify the impact of the work that we do. And we have a host of members that have partnerships, stakeholders that we would like to acknowledge, being Senator Charles Schumer, Congresswoman Grace Ming, Congressman Gregory Meeks, Queensborough President Richard Donovan, Senator Leroy Comrie, Senator John Liu, Senator James Sanders, Assemblymember Alicia Hyman, Assemblymember David Welpern, City Council Speaker Adrian Adams, City Council Member James Gennaro, City Council Member Natasha Williams, City Council Member Selvine Brooks Powers, District Leader Anthony Andrews, District Leader Jacqueline Boyce, the YMCA of Jamaica, and Sharing and Caring. And that concludes my report for Queens Hospital.
Thank you very much for your extensive report and your detailed report. And in that report, explaining to us also what you're doing at Queens to take care of those few areas that you felt deficient in. So I appreciate that. I wanted to point out to everybody that this is a new report model that we're using. I want to thank our Chief of Staff who worked extremely hard in putting it together. I think she put it together. And whatever helped. Would you like to acknowledge who else helped you with it then? Okay, so it was a team effort from our front office to do this. So I want to thank them for all that they did. I do want to ask if there are any questions from our board members.
Terrific report. At our next meeting, I'd love to hear more about the master plan that's being developed. Sounds very exciting.
Okay, with all of our business done at 4 minutes of 6, any old business? Any new business? I call for a motion to adjourn. Thank you, we're adjourned. Thank you for an excellent meeting. I look forward to seeing you in March.
Thank you.